Welcome, everybody, to another episode of Connect with HSPC. So happy to be here for this episode of our webcast. My name is Melanie McGregor, and I'm the chair of the Halton Suicide Prevention Coalition. And joining me today for this interview is Melissa Graves, who is the vice chair of the coalition. And really excited about this episode today. We always love when we can highlight some resources that are available in our community, because those are a lot of questions that we get, are how do people find support? So really happy to have with us today Jennie Kiddle. So Jennie is a clinical manager at ROC, which is Reach Out Center for Kids, which is the lead mental health agency in Halton, and ROC has been part of our Suicide Prevention Coalition for quite some time. So Jennie has been in leadership at ROC for 7 years and has worked at ROC for over 20 years. So currently, one of Jennie's roles is to supervise the counselors who work in the One Stop Talk provincial support program. So thank you so much for being with us, Jennie.
Thank you. Thanks for inviting me. I'm really happy to be here and happy to talk about One Stop Talk.
Great. So we know that you do have a PowerPoint deck that you're going to go through. So we are going to bring some slides, and we leave it to you to take it away and tell us more about One Stop Talk.
Super. So One Stop Talk, Parlons Maintenant, is a provincial virtual counseling support. And this is a free, easy to access virtual counseling program that is available to children, youth, and their caregivers all across Ontario whenever they need mental health services from a certified clinician. So One Stop Talk came from a big, bold idea that the Child and Youth Mental Health Lead Agency Consortium put together. So One Stop Talk is a collaborative effort to address systemic challenges in child and youth mental health in the children and youth mental health sector. So there are 31 lead agencies across Ontario, and that covers 33 service areas in the whole province of Ontario. So leadership and commitment for this idea was absolutely applauded by the Ministry of Health when they heard this big, bold idea for a provincial counseling program that could be accessed across the whole of Ontario. And that's how the idea came to be. So the provincial collaboration was with the Ontario government, with the Child and Youth Mental Health Lead Agency Consortium, so all the children's mental health lead agencies, Capitalize for Kids, and the Knowledge Institute, and Strides Toronto, which is the agency that has really spearheaded with ROC the co-chairing of this pilot. So mental health care and support is needed now more than ever. We know this, and experts have a particular concern for youth, especially since the onset of the COVID-19 pandemic. We knew that the need for child and youth mental health services was on the rise, and we know this even more now since the pandemic and the impact of the pandemic. So the idea behind One Stop Talk was, let's provide in-the-moment access to single-session counseling services, and let's have a direct impact on supporting children who exist on current or future wait lists. So families and children who were on the current wait lists of the agencies that started in the pilot were offered this service first in order to let them know that we were aware they were on our wait list, and we wanted to offer them this opportunity to have a counseling session while they were waiting. The hope was also that we could divert those that were on the trajectory with more complex service needs by doing early intervention and offering this service much sooner, so that families didn't have to wait on a wait list for a really long time to get the service that they needed. Perhaps that early intervention could then allow them to not need more intensive services later on. The idea also came from the fact that we could now share technology. So since the COVID-19 pandemic, we realized that virtual care is safe, it's effective, families access it children and youth feel comfortable with it. So we could share that technology and offer a platform that everyone could access across the whole province. And a provincial system of brief services that we could really weave our current resources together to offer something that was shared, because we know that lots of agencies across the whole province offer walk-in clinics, offer brief services, offer therapy. And by bringing all of our resources together and making one big resource, we're sharing all that wealth of knowledge that we have in all of our agencies across the province. And being able to offer a standardized provincial approach to brief clinical services so that it's the same intake, we're collecting the same data from everyone that joins, and we have evaluation built into the service that we're providing. So those were some of the big ideas that really promoted One Stop Talk. So how the virtual platform works. So anyone across the province of Ontario under the age of 18, children and youth under the age of 18, can log on to onestoptalk.ca. So a child and family can connect to the virtual clinic, and it can be done through chat, through video, or through a phone call. And that's all available on the onestoptalk.ca. All the information there for the phone number and the website is the way to access the virtual platform. So they can connect with that one click anywhere across Ontario. And once they connect on the platform, the AI system responds with a few key questions to get them into the roster so that they can be matched with a counselor who can provide them the services that they're looking for. And the queuing up and getting matched to a clinician is typically happening in under 5 minutes. So the time that the child, youth, or family logs on to the time that they are starting their session with a clinician is usually under 5 minutes. So the provider offers support to the client, and then they co-create a plan. So best practices are used to offer resources, and assessment tools are used. It's an hour maximum session, and the service is complete at that point. And at that point, the plan can be shared with the client, or if needed, the client can be connected to a navigator for linking to services in their own community. So that's one of the big differences with One Stop Talk, is that referral is possible as well. So the system generates a referral option and populates the necessary data so that that referral can go to the agency that's in the client's home community. So referrals can be made, shared with consent, with the child, youth, or family's consent and permission, shared to their local agency to link them into more services if needed. And that referral is made, and then that community that they live in, the agency there acknowledges that receipt of the referral and reaches out to them to bring them into their services. So that's a way of connecting them to their local services. Even though they've accessed the provincial counseling clinic, they still get that link into their home community. So clients benefit from the One Stop Talk program because they're getting a counseling session right away in the moment when they need it from experienced therapists across the whole province. And clients can have access to One Stop Talk after hours and also on Saturdays. So the weekdays, the clinic is open from 12 until 8, and then Saturday afternoons as well. And then they have the opportunity to self-select services that are right for them if they need more services. And our hope is that it could divert those that are on that trajectory for more complex service needs by use of this early intervention when they need it, when help is required. So One Stop Talk provides children, youth, and families with equitable access to in-the-moment counseling services, regardless of where they live. So a family from Toronto logging onto the system would have the exact same service as a family who's logging on from Timmins or Sudbury or Ottawa. They can log on from anywhere across the province and get the same service that's accessible, it's free, and comfortable for them. So the journey that we've been on for One Stop Talk to get to where we are today, it started in fall of 2020 with this big, bold idea that if we pool our resources, we could come up with something amazing. And in June 2021, the Ministry of Health said yes and funded this program, and they are backing it and are incredibly supportive to have this be taking off. So November 2021, 8 provincial working groups were established, and February 2022, working groups, they made recommendations around the program design and how everything was going to take off. And then by July 2022, we'd landed on 6 pilot sites that would start the program. And Rock was one of those pilot sites. And in November 2022, we launched, the pilot launched. So the agencies that were signed on for the first stage of the pilot were each able to offer one-stop talk to their current families, their waitlist families, and anyone that was already in their system. And January 2023, which is this year already, a community of practice was launched. So all of the counselors and clinicians that are part of One Stop Talk attend a community of practice where they are learning, building their skills in evidence-based practice, collaborating with trainer support. So they have consistent ongoing training. And now in Q4 of 2023, we are now in phase 2, which is adding additional agencies. And by June 2023, we will be in phase 3. And then in this September 2023, will be a full public launch across the whole province for anyone to be able to access One Stop Talk. So clients benefit from the program because it's really filling the need in the system. So youth today can access One Stop Talk and talk to someone that they can trust and they feel safe. One Stop Talk offers children and youth and caregivers timely, easy to access virtual counseling with a certified clinician wherever they are across the province. It's free, it's safe, and it's confidential. One Stop Talk allows youth to have the opportunity to connect with a certified clinician and receive counseling when they need it, and if required, help them develop a plan that links them to their home community and more services if they need it as well. So the participating sites right now in our phase 2 are all across the province, and this is a list of them. And Rock is in our home community, obviously. So One Stop Talk by numbers at this point, we have June 1st, 2021 was when Ministry of Health agreed to fund One Stop Talk pendant maintenant. And now we have over 60 clinicians that are supporting One Stop Talk. So all of the agencies have clinicians within their own agencies who are supporting One Stop Talk several days a week and are hired by their own agencies. And we're offering One Stop Talk 44 hours a week to cover 6 days of the week. And so we have 14 sites right now that are offering One Stop Talk in their communities, and that means 37 referral points. So right now we have engaged over 500 clients on the One Stop Talk platform and offered services to over 500 children, youth, and families. We have access to the web. We've launched our new updated website, onestoptalk.ca, and clinicians have already received over 14 hours of training, and our volume is doubling every month. One Stop Talk is the only online mental health service that provides free single session counseling support for youth, children, and their families, with access, if needed, to longer term counseling services, and that is if it's required. For many users, what we found is that a single session is really all they need, but One Stop Talk also offers solutions and guidance for ongoing care online in their community or wherever they feel most comfortable. So it's about youth receiving immediate and effective counseling and getting a plan for their care if needed for long-term. And One Stop Talk is making a meaningful difference in families' lives already, and we've just gotten started. So I'm wondering if you have any questions.
That's amazing. Like the words that stuck with me were in the moment access, because we hear so much about, well, there's wait times, or maybe people aren't sure where to go, or there aren't resources available in their community. So to hear, in the moment access, that's amazing. Wow. Thank you for all that info. So
I also, sorry,
yeah.
Melanie. I just wanted
No,
to
go ahead.
mention something that stuck with me that I love, Jennie, was the equity of the access. So when you mentioned that someone in someone in Timmins is receiving the same service, because I think we know when it comes to mental health support, there is a lot of inequity. So it's great to hear that, everyone across the province is able to receive the same quality of service. So that's great.
Yeah. Amazing.
Yeah, that's been really exciting, is to know that really a family could be logging on from anywhere and they're getting the same service, same quality. That feels really good to our clinicians.
Absolutely. That's great. So I'm wondering, like, when you think about, you say that your volumes are doubling monthly, we know the demand is there, but what are things that you're hearing from youth? So when they're calling in, looking for that support, what are some of the things that they're coping with, or what are some of the things that they're needing support with? What are kind of some of those trends that you're seeing?
Yeah, I think we're noticing across the board lots of concern with, there can be social difficulties, there can be feelings of anxiety and worry. We're hearing from youth that are feeling kind of low and down and struggling and stressed. We have that at different times of year that can be really big for youth, especially coming out of a pandemic. So we're hearing a lot of that. We have families that are struggling with a parent-child conflict, and so they're joining with their youth. And it's across the board, like you just never know what you're going to get. But yeah, I would say those are some of the things that stand out.
Thank you.
Great, Jennie. Thank you. We know post-COVID, there's been definitely an increase in people in distress, youth in crisis. Pardon me. So what support do you provide if a caller states that they're having thoughts of suicide?
Yes, so our clinicians are really well trained in being able to listen for any expressions of thoughts of suicide, and they have some assessment tools that they use to assess for risk. They use a HSPC assessment, and if that is mentioned, then they are using their skills to look at whether this is a safety plan is needed, if they need to be linked to crisis counseling in their home community. Obviously, if there's a need for immediate support, then they would be supporting the youth to reach out immediately, but linking to our home community. So if it was a family in Halton that was accessing One Stop Talk, and that link could be made to the ROC 24-hour crisis line, that link would be made, and really assessing for risk as the conversation unfolds. So they're definitely listening for that and supporting those kind of safety conversations.
Okay, great, thank you.
Yeah, that's a really great point around how One Stop Talk may be the first step into connecting with some local resources. So you mentioned the crisis line at ROC. Are there what other types of resources are the counselors finding that youth are needing, or what are some of those linkages that those are that they're making? What kinds of services are the next steps, do you think?
Yeah, they are linking often back to ROC for other services such as brief therapy. Sometimes the families and children are interested in a group that's in their community as well. And so that referral can be made back to ROC for any of our prevention groups that we offer, any of the other programs that are through our access line through the access and system navigation, being able to link to all of those programs across the community, whether it's Woodview, whether it's the Nelson Youth Center programs through ROC, lots of different ways to link into those programs.
Okay, very good. Thank you.
I think it's important. I will point out when you mentioned about if we are hearing a youth express any thoughts of suicide, that this wouldn't replace a crisis line. So I think that's an important thing to really emphasize, is that we wouldn't offer one-stop talk if a person was in crisis as the solution. We would be continuing to use the things that are already in our community, whether it's the crisis line or accessing hospital or emergency services, for sure.
Okay, yeah, important to know.
Yeah.
Excellent. So I think, yeah, Melissa, other questions that you have?
I think you said, I mean, we were wondering a bit about how people can reach out to One Stop Talk. I think you mentioned that there's phone line, there's a text option, there's a chat option. So there's a couple different options for people to access. Is that correct?
Yeah. So I think the best bet is to go to the onestoptalk.ca website, and there the link to the phone number is there, or the virtual chat can start. So that would be the best place to start. And we also have access to their social media for linking. So we'll put that up at the end as well. And that's the best way. So what we're noticing is that children, youth, and caregivers with their youth and caregivers with their children are also accessing One Stop Talk. Yeah, so here's the new website. This is great. And so if a person is joining the website, then they can click that red button to get started. And you see the phone number there as well, the 1-855-416-8255. Excellent, is the phone. And so the hours there are listed as well, Monday to Friday, 12 to 8, and then Saturdays. Saturday afternoons at this point, Saturdays 12 to 4. And so that's the AI chat that you see there that starts, well, right now it's saying that it's closed because we're recording this in the morning. But the client that's logging on can start to answer some of the questions that pop up in the chat around, are you wanting to speak to a clinician? Are you wanting to do video? Some of the questions start prompting to get them in the right queue. And we also offer French, so it's a bilingual service, so that we are obviously accessible to all families in Ontario. So it can be French and English, and interpretation services are also available. So if one of the prompts is that if a family is needing the session in another language, to let us know what that language is, and then we link to ASL or language interpretation.
Oh, excellent. That's really helpful. Thanks, Jenny.
Yeah, no problem.
Nice to get a look at the website too. So yeah, we will definitely share those contacts at the end of our session today. Yeah,
so all those languages are listed, and then we actually have a French language clinician as well who will do the sessions exclusively in French as opposed to needing the interpreter. So we have French and English counselors.
Great. Very good. Wonderful. Well, thank you for all this information. Is there anything that we haven't asked about that you would like to share about One Stop Talk?
I would just say feel free to promote and let families in Halton know that One Stop Talk is available to them, and that we are definitely one click away, and we have lots of great counselors that are there and available to do single session, and they're excellent and eager and very ready to support.
Oh, wonderful. Again, always great to find out about these resources that are making things more available. So thank you for everything that you're doing with One Stop Talk. Like, definitely, this is needed. This is needed. So happy to have you with us today. And thank you so much for sharing such great information.
Thanks for inviting me.
So thanks everyone for joining us for this episode. Definitely stay tuned for our next one. And we will talk to you soon. Thank you.